Hi everyone, and welcome back to Dr. Curnew's YouTube channel. Today, the Breathing Club is here to talk about a condition that affects millions of people but often goes undiagnosed: sleep apnea, specifically obstructive sleep apnea. If you or someone you know snores loudly or wakes up feeling exhausted, this might be something to pay attention to. So, what is sleep apnea? Sleep apnea is a sleep disorder where breathing repeatedly stops and starts during sleep. There are different types, but the most common is obstructive sleep apnea. Obstructive sleep apnea happens when the muscles in the back of the throat relax too much while you sleep. These muscles support your soft palate, uvula, tonsils, and tongue. When they relax, your airways become narrow or completely blocked, making it very difficult to breathe. This lowers the oxygen in your blood, triggering your brain to briefly wake up so that you can breathe again. These interruptions can happen multiple times per hour, preventing deep, restful sleep.
The most common symptoms of sleep apnea include loud snoring, episodes in which you stop breathing during sleep, gasping for air during sleep, awakening with a dry mouth, a morning headache, difficulty staying asleep known as insomnia, excessive daytime sleepiness known as hypersomnia, difficulty paying attention while awake, and irritability. In terms of causes, there can be an airflow blockage in your upper airway during sleep, or a problem with how your brain regulates your breathing during sleep.
Alongside the number of symptoms mentioned, sleep apnea can also have significant effects on heart tissue and function overall. First, during sleep apnea episodes, the decreased levels of oxygen and increased carbon dioxide levels induce the activation of the sympathetic nervous system, or in other words, our flight or fight response. This will result in an elevated heart rate, increasing the workload on the heart. The lower oxygen levels can also lead to electrical instability in the heart, increasing the risk of arrhythmias. Alongside this, sleep apnea is associated with fluctuations in blood pressure during sleep, which can contribute to sustained hypertension. These repeated changes can also cause structural changes in the heart, such as the enlargement and thickening of the left ventricle, impairing cardiac function. According to various studies investigating obstructive sleep apnea, there is an associated link between these episodes and the risk for cardiovascular disease. This can include an increased risk for coronary artery disease, congestive heart failure, and even stroke, emphasizing the need for a preventative approach.
Now we're going to be moving on to treatments, and this is actually one of the main reasons why we decided to discuss sleep apnea in the first place, was the recent news that the FDA has approved Trizepetide as the first drug for obstructive sleep apnea. Trizepetide is a dual agonist for glucagon-like peptide 1 and glucose-dependent insulinotropic polypeptide. This means it stimulates the actions of these hormones on their corresponding receptors, which suppresses appetite and stimulates insulin secretion, thus targeting elevated glucose, dyslipidemia, and obesity. Thus, it should come as no surprise that Trizepetide has already been approved for treating obesity. So the question is, why would it also be useful in treating sleep apnea? The reason is because obstructive sleep apnea is most common in overweight individuals, since fat deposits can narrow airways, obstructing regular breathing. The approval comes following the publication of 2 randomized control trials. Both trials found a significant reduction in sleep apnea for patients that took Trizepetide over a placebo after 52 weeks. As you can see in this graph here, it led to a further reduction in either 20 events or 23.8 events, depending on the trial. Similarly, we can also see that amongst most common adverse events, there was a significant reduction when patients took Trizepetide versus the placebo in both trials, which I've boxed in here to make it more clear. Moreover, the FDA also pointed out that Trizepetide should be combined with exercise and caloric reduction. So we know that Trizepetide is certainly a promising treatment for sleep apnea, but what other treatments or lifestyle modifications exist? As I kind of alluded to earlier, lifestyle changes, which include healthy eating, regular physical activity, good sleep hygiene, and restriction on alcohol, caffeine, and smoking can certainly help alleviate sleep apnea. Your healthcare provider may also suggest that you sleep on your side as opposed to your back to help open up your airways. A PAP, or positive airway pressure machine, is another common treatment for sleep apnea. While there are different types of PAP machines for different needs, they all have the same basic function, where they deliver air pressure to the mouth and or nose to keep the airways open, which helps you breathe easier at night. And as you might expect, PAP machines are most effective when used in tandem with lifestyle modifications that I mentioned. Patients that cannot use PAP machines may be prescribed an oral device to be placed in the mouth in order to keep the airways open during sleep. And finally, surgical options also exist for sleep apnea. For example, surgical removal of tissue from the mouth and throat may help enlarge the upper airways. Weight loss surgery may also be beneficial if other treatments prove ineffective and the obesity is contributing to sleep apnea.
If you would like to learn more about healthy sleep habits, check out our video on tips for better sleep, or check out our YouTube playlist about sleep and stress management. Thank you all so much for watching. We hope you learned something new from this video.